All right, welcome everyone. Thank you for being here. My name is Aaron, and I'm on the National Climate Assessment Team here at the U.S. Global Change Research Program, or USGCRP. Before we get started, I want to draw your attention to the note in the chat box. Microphones are disabled for all participants today, but if you have questions or comments throughout the session, please enter them in the chat. If you have any technical difficulties, please contact Reed, who is our tech support person today. And also note that all participants are expected to be respectful and considerate towards others per the USGCRP Code of Conduct. Next slide, please. I'll kick off our webinar today with some background information about the National Climate Assessment before turning it over to the air quality chapter authors. Next slide, please. So, the U.S. Global Change Research Program was mandated by Congress in the Global Change Research Act of 1990 to assist the nation and the world to understand, assess, predict, and respond to human-induced and natural processes of global change. The program convenes 15 agencies to advance climate and global change science and to provide useful and usable information to decision makers. Next slide. That same law that established the program also mandates a periodic scientific assessment known as the National Climate Assessment, or NCA. NCA is a quadrennial report that analyzes the effects of global change on several sectors: the natural environment, agriculture, energy, land and water resources, transportation, human health, social systems, and biodiversity. The USGCRP is charged with assessing current trends as well as projections for the next 25 to 100 years. The NCA is used by organizations and individuals for a variety of purposes, which include national policymaking, risk management in the private sector, local mitigation and adaptation planning, as well as by practitioners, utility managers, and educators. Next slide, please. The NCA authors review a large body of scientific research from diverse information sources. They also synthesize that information, examining the confidence in our scientific understanding and evaluate uncertainties. NCA5 was written by 500 authors and 260 technical contributors from every state in the nation, as well as Puerto Rico, the U.S. Virgin Islands, Guam, and Palau. The NCA is designed to be policy relevant. Authors distill their findings into accessible language framed around risks to people and important resources. But that said, the report is strictly not policy prescriptive, and it doesn't advocate for particular viewpoints or policy measures. The NCA uses a range of future projections to help decision makers understand the full extent of possible risks that can be avoided or reduced under different scenarios, and leaves it up to that decision maker to ultimately determine the risk threshold. The assessment is compliant with all applicable federal laws and policies, including the Global Change Research Act, as well as other laws that govern things like information quality, accessibility, and transparency. The report process involves extensive review, including several opportunities for public engagement, a review by the National Academies of Sciences, Engineering, and Medicine, and several government science reviews. Next slide, please. All right, let's take a look at the NCA5 table of contents. Like previous NCAs, NCA5 covers national level topics, regions, and response actions. The report opens up with an overview, followed by 2 chapters dedicated to the physical science of climate change. Then there are the national topic chapters, the 10 regional chapters, and 2 response chapters, although response actions are discussed throughout the report. The NCA table of contents has evolved over time, informed by user input. NCA5 added 2 new chapters, one on economics and one on social systems and justice. We also have 5 new focus features, including compound extreme events, Western wildfires, COVID-19, supply chains, and blue carbon. We have several appendices, including a new one dedicated to indicators as well. All right, now that we've gone through some intro background, it's my pleasure to introduce Jason, the top chapter lead of the air quality chapter, who will lead us through the remainder of the webinar today. Thank you.
Thanks very much for the introduction. I'm Jason West at the University of North Carolina. I was honored and privileged to have been asked to lead this team, and what made it such a wonderful experience was the great team of chapter authors that we put together and the contributions of each and every one of them. I want to thank in particular Leo Goldsmith and Chris Nolte for the significant roles that they played. thank GCRP and the technical support unit for their help with graphics and editing text. We'll be presenting today on the air quality chapter, of course, but our chapter does not exist in isolation of other chapters. In fact, there was quite a lot of work to integrate our chapter with other chapters that were related. And so I wanted to mention that we've worked quite a lot with authors from these chapters, the two physical science chapters, forests, built environment, transportation, human health, mitigation, several regional chapters, and with the focus boxes on Western wildfires and COVID-19. So those listening might want to check out those chapters as well for related content to what we'll be talking about today. I'll start by setting the stage by saying that air quality is vital for health and the environment. Air quality is influenced by a variety of different pollutants, including pollen that we have an emphasis on, but our main focus in the chapter is on ambient fine particulate matter measured as PM 2.5 and ozone. The backdrop for this chapter in the United States is that we've made over the last several decades extremely successful strides in cleaning up our air, more so I think than the general public appreciates, as shown by the decrease of PM 2.5 over 2 decades by about 41%. Despite that decrease, we still have a significant public health issue stemming from air pollution. We estimate that about 60,000 Americans die prematurely each year due to exposure to ambient air pollution, PM 2.5 and ozone. That number of 60,000 per year is more deaths in the United States than all motor vehicle accidents, kidney disease, breast cancer, or prostate cancer. That number of 60,000 per year also varies in the literature. We identified studies that were as high in the United States as 260,000 deaths per year. And in addition to deaths, air pollution causes many non-fatal health impacts, including respiratory attacks, emergency room visits, and days of lost worker productivity. Air pollution affects the world around us, including plants, and estimates damages to crops within the United States are estimated at $12 billion per year. Despite the improvements we've had in air quality in the United States, it's still the case that over 100 million Americans live in regions that exceed health-based air quality standards in 2021. Recently, many of you might have seen that the PM 2.5 standard was lowered now to 9 micrograms per cubic meter as an annual average. And so this number of 100 million Americans is likely to go up. And finally, it's important to recognize that not every American breathes the same air. And over the years, we've identified that some Americans, and especially Americans that are part of different socioeconomic or racial groups, are exposed to more polluted air than other people are. What's new in NCA5? Of course, we wanted to incorporate the latest science here. We also increased our emphasis on wildfire smoke, given the fact that over the past several years, we've just seen wildfire smoke become more prevalent and attention-grabbing as it's gotten front page news. We added a new section, which is our key message 14.3 on air quality disparities and environmental justice. We included a focus box to look at these issues in the context of Houston, Texas, and you'll hear about that more. We also added a new emphasis here on the opportunity to address air quality and climate changes simultaneously. These are the 5 key messages in our chapter. Key messages 1, and you'll hear about each of these in order, but key messages 1, 2, and 4 have to do with the impacts of climate change on air quality and therefore on health. Key message 3 takes a different look at that, where we're focusing on the air quality challenges faced in particular by communities of color and low-income communities, and thinking about that differential exposure in the context of climate change. And key message 5 also takes a different look at this issue by focusing on how greenhouse gases and air pollutants come from the same sources by and large, and therefore we think about and emphasize the opportunities to take actions that would reduce, that would address these two problems of climate change and air quality in the United States simultaneously. Arlene.
Great. Hi, everyone. I'm Arlene Fiore at MIT, and I'm really delighted to get to be here today and talk to you about our key message 1. And so we spent a lot of time thinking through every word that goes into these key messages. And so I'm just going to read through what we came up with here. The overall statement is that climate change will hamper efforts to improve U.S. air quality. And climate change is projected to worsen air quality in many U.S. regions, thereby harming human health and increasing premature death. Extreme heat events, which can lead to high concentrations of air pollution, are projected to increase in severity and frequency. And this we assigned very likely, very high confidence to. And the risk of exposure to airborne dust and wildfire smoke will increase with warmer and drier conditions in some regions. And thus, reducing air pollution concentrations will unequivocally help protect human health in a changing climate. Next, please, Jason. And so I wanted to take a minute to illustrate some of the complexities associated with trying to predict how climate change will affect U.S. air quality. And this figure is illustrating the various sources of air pollution, which include those resulting from human activities, as well as those resulting from natural processes. And many of these sources themselves vary with the weather and thus are expected to change with climate. For key message 1, we're focused primarily on fine particles and ozone. And so fine particles are tiny liquid or solid particles suspended in the air. And some of those are directly emitted, but others, as well as ozone, an important gas that's a key air pollutant, forms through atmospheric chemistry or reactions that occur in the atmosphere in the presence of sunlight, and thus depend strongly on atmospheric conditions, such as temperature or humidity or winds. And so predicting climate change impacts, as I said at the beginning, is complicated because of the many different sources, the chemistry, and also the removal pathways that vary in different ways with the weather. Next slide, please. So we assessed the different pathways through which climate change is projected to alter concentrations of both ozone and fine particles. And I'm just going to walk quickly through the key points of this figure, and which is that the red icons are indicating processes that are known to lead to increases in both ozone and PM. And so, in other words, wildfires will produce more ozone as well as more PM 2.5. The blue icon is denoting that PM 2.5 decreases with precipitation. You'll see plus and minus signs next to ozone and PM, and that's indicating the sign of the change in response to an increase in that particular pathway. The question marks indicate uncertainty, as do the purple icons, and that uncertainty stems either from the response of PM and ozone to that process in some cases, or in some cases, how that specific meteorological process will respond to climate change, or that we expect that there's regional variations in the responses to climate change. And so our key takeaway here is that climate change will have varying effects on ozone and fine particulate matter concentrations, including through the impacts of climate change on weather-sensitive emissions. Next slide, please. So what this figure is illustrating, and there's a lot here, we'll spend some time on it, is our results from our current generation of models that are climate models that include the chemistry needed to simulate air pollution. And all of the lines here are plotted as changes relative to an average taken over 2015 to 2024, and also averaged regionally over the entire contiguous United States. The model simulations include the combined effects of air pollutant emissions and climate change. The thick lines are the average across the available models, where the black shows the historical period and the colors indicate future air pollution levels under 4 different possible scenarios for emissions of air pollutants and greenhouse gases. The thin lines indicate individual models, where the difference across those thin lines is intended to represent uncertainty that results both from uncertain representation of the processes in the models and also uncertainty that results because we have natural weather variability that occurs in the atmosphere and is simulated in these models. The top panel is showing annual mean PM 2.5, and as Jason noted, clean air policies have led to decreases over recent decades. And although the observations aren't shown here, that this is consistent with observations. The bottom figure shows a metric for surface ozone, specifically the maximum daily 8-hour average. In this case, averaged over the entire summer from June through August, and also averaged over the contiguous United States. I'd just like to note that when you're looking at averaged quantities like this, it hides decreases in our highest ozone concentrations that have been observed to happen. For instance, the 98th percentile of this metric came down by about 18% from 2000 to 2020. So these projections do not include an expected strong influence of climate change on wildfire smoke. But nevertheless, they show that reductions in human-caused emissions that contribute to ozone and fine particulate matter are expected to improve air quality in a changing climate. And we can see that by the difference in the values projected out under our 4 possible scenarios. So thank you. I'm going to pass on to our speaker for key message 2. Loretta.
Hi, everyone. My name is Loretta Mickley, and like Arlene, I'm delighted to be here. I'm at Harvard University. So as Arlene mentioned, those somewhat encouraging pathways in the last slide did not include the influence of smoke on PM 2.5. And our key message, number 2, is that increasing wildfire smoke is harming human health and catalyzing new protection strategies. And I'll read our key message components. Wildfires emit gases and fine particles that are harmful to human health, contributing to premature mortality, asthma, and other health problems. But climate change is contributing to increases in the frequency and severity of wildfires, thereby worsening air quality in many regions of the US, contiguous US, and Alaska. However, although large challenges remain, new communication and mitigation measures are reducing a portion of the dangers of wildfire smoke. And I just want to call your attention to the series of panels at the bottom. This is artwork contributed to the report, showing the same landscape painted by the Miss Plumbley on different days, and you can guess which days were smoky. Next. So let's look at trends in fire activity in the US. The panel here shows annual area burned in forests in the Western US, going from the mid-1980s to 2020. The green and yellow curves denote fire area burned in different kinds of land, and the gray indicates the total area burned, the sum of these curves. and the gray corresponds to the right-hand axis. And you can see pretty clearly that despite a lot of interannual variability, fire activity in the Western US does appear to be strongly ramping up. So as the climate warms, fuel dries out and increases fire risk. And we think that's one reason why we see increasing area burned. Wildland fires are now the largest contributors to PM 2.5 in the Western US. But keep in mind that fire is a natural part of many ecosystems. And scientists have found that applying prescribed fires to clear out underbrush may limit the risk of future large catastrophic fires. Next slide. So how do we communicate smoke risk to the public? The top panel is a snapshot of air quality across the US, Alaska, and Hawaii on one particularly smoky day in 2020. Each dot represents a different air quality sensor. And the darker dots, the purple, brown, and red dots, indicate unhealthy or even hazardous air. The green dots in the east indicate good air. And the yellow is unhealthy for sensitive groups, including people who are exercising. And now in the gray, you can see smoke plumes derived from satellite data, and those plumes stretch all the way across the US. On this particular day, it appears that the smoke plumes, by the time they reach the east, are pretty much aloft and not affecting air quality too much. Although the western third of the US is indeed showing degraded air quality. However, on some days in the east, we do indeed see the effects of smoke. So in particular, last summer in June, the eastern US experienced several days of intense smoke barreling down from the fires in Canada, as shown here in New York City on June 7th. So taken together, we know that smoke from fires can travel many hundreds of miles, affecting air quality downwind. And forecast-based interventions of smoke or communication tools like the one shown here can help protect public health. And we've learned that masks and air filters can also limit smoke exposure. And now I'll hand things off to Sally.
Hi, everyone. My name is Sally Passetti. I'm an associate professor at the University of Virginia, and I'm very happy to be here with you today to present the findings of Key Message 3, titled Air Pollution is Often Worse in Communities of Color and Low-Income Communities. And like my colleagues, I'm going to read Key Message 3. Communities of color and people with low socioeconomic status and other marginalized populations are disproportionately harmed by poor air quality. In the coming decades, these same communities will, on average, face worsened cumulative health air pollution burdens from climate change-driven hazards. Decision-making focused on the fair distribution of air quality improvements rather than on overall emissions reductions alone are critical for reducing air pollution inequities. Next slide, please. So I want to start, when we think about air pollution and we think about air, we think of that as evenly mixed across cities. But in fact, that's not true, that we can see really large differences within the atmosphere, heterogeneities within the atmosphere. And if we're very close to a freeway, for example, in comparison to standing within a large park, we're going to be breathing very different air pollution, even though we're in the same city. And so my first point here is that neighborhood level air pollution can be highly variable. And air pollution inequalities, these are going to be affected by the distribution of sources. And these sources can range from diesel truck traffic, the location of industries. I'm showing you here a photograph. This comes to us from Cassandra Casados-Klein at Air Alliance Houston, an environmental justice organization there, of a house located in close proximity to an industrial facility that's flaring at night. Other types of sources can include agricultural burning, animal operations, power generation, and oil and gas infrastructure. And these are all sources that we saw evidence for in the literature of causing environmental justice issues. Next slide, please. So climate change is affecting the amount of air pollution, but it's also affecting its distribution and its inequitable impacts. And so air quality health impacts are magnified by factors that include reduced access to nutrition, institutional support, healthcare, as well as psychosocial stress from racism and poverty. And environmental inequalities often overlap. As a result, exposure to both poor air quality and higher than average urban heat might land on the same community. Moreover, exposure to heat can worsen air pollution health outcomes, so they can be reinforcing as well. Next slide, please. So this is a picture of the Houston Ship Channel for those of you who haven't been to Houston, and you can see that there's a large industrial region that's in very close proximity to downtown Houston. And we feature some of the unique air quality and environmental justice issues in Houston as part of our chapter. Next slide. And so here you can see a set of 4 panels. This comes from our feature box on Houston. On the left, you're looking at the population, the majority population, when that population is African American in blue, Latino in green, and Asian in orange, in the city of Houston. And the black box in this image is the Houston Ship Channel. So just to the left of that is downtown Houston. In panel B, you're looking at the distribution of a pollutant called nitrogen dioxide. This is emitted by vehicles and industrial activities, diesel trucks, those large, very large freight trucks that you see on the freeway emit a lot of nitrogen dioxide. Here we have the lifetime cancer risk from exposure to air toxics in panel C. Again, you can see that that's elevated over neighborhoods in the Houston Ship Channel. And then on the right in panel D, you're looking at the summer air temperature. And so what I want you to take from this figure is that we see these overlapping environmental burdens over neighborhoods in the Houston Ship Channel. And these are also places within Houston where we have large populations of Black and African Americans and Hispanics and Latinos. So if you're interested in learning more about the unique air pollution related environmental justice issues in Houston, please visit our feature box in our chapter. Thank you.
Jeremy, would you like to talk?
Yeah. Hi, everyone. I'm Jeremy Hess. I'm a professor of emergency medicine, environmental and occupational health sciences, and global health at the University of Washington. And I was one of the authors that worked on pollen for the air quality chapter. Our key message 4 focuses on aeroallergens. And like my colleagues, I'll read the text here. Increased allergen exposure damages the health of people who suffer from allergies, asthma, and chronic obstructive pulmonary disease, also known as COPD. This is a finding that we have very high confidence in. Human-caused climate change has already caused some regions to experience longer pollen seasons and higher pollen concentrations, very likely, high confidence. These trends are expected to continue as the climate changes, again, very likely, with high confidence. Increasing access to allergists, improved diagnosis and disease management, and allergy early warning systems may counteract the health impacts of increasing pollen exposure. And we have high confidence in this finding. Next slide, please. As you can see here from some artwork from a young person who contributed to the NCA, there's a clear linkage between human health and the activity of plants and other aspects of the ecosystems that we're a part of. And many of those plants exhibit sensitivity both to temperature and to precipitation and to atmospheric carbon dioxide concentrations. And as a result of that, we are seeing shifts in the pollen season and increases in allergic airway disease. We're seeing shifts both in exposure to pollen and to mold. And this results in shifts in both development of allergic airway disease and changes in symptoms among people who are sensitized and exposed. The seasons for pollen are particularly well understood, and we're seeing clear changes. We have good evidence that those changes are linked or attributable to climate change. And in particular, what we're seeing is that the pollen season is starting substantially earlier in many locations, and overall concentrations of pollen over the course of the pollen season are higher. And we have multiple opportunities to better track these changes and improve the health protections that I referred to. Next slide, please. And this is a figure from the report that highlights both in panel A, changes over time in long-term pollen trends. And what you can see here in the majority of sites that were studied, there's an increase in the concentration of aeroallergens. And this follows something of a latitudinal gradient. However, not all locations are experiencing changes. We do see some locations where there are moderate declines in pollen concentrations. And in panel B, you can see that the local ecology of a particular taxa or group of plants that produces allergenic pollen is quite different and affected by climate change in different ways. So panel B shows changes in ragweed pollen concentrations projected forward over the middle of the century. And what we see here is that some places experience substantial increases in pollen concentrations. Those are highlighted in the orange and brown sections of the map. And some areas experience significant, but not quite as dramatic, declines in concentrations. And this has to do with changes in temperature in particular, and the hospitability from an ecological perspective for ragweed in those locations. And I'll hand it off to the presenter for keynote.
Great, thank you. I'll wrap it up with key message 5. So here we emphasize that policies can reduce greenhouse gas emissions and improve air quality simultaneously. Substantial reductions in economy-wide greenhouse gas emissions would result in improved air quality and significant public health benefits. For many actions, these benefits exceed the cost of greenhouse gas emission controls. Through coordinated actions emphasizing reduced fossil fuel use, improved energy efficiency, and reductions in short-lived climate pollutants, the U.S. has an opportunity to greatly improve air quality while substantially reducing its climate impact, approaching net zero CO2 emissions. So as a starting point, fossil fuel is the major source of both greenhouse gases and many air pollutant emissions. Given that they share the same source, many actions that we would take to reduce greenhouse gases will also improve air quality. But this is not what we've seen historically. What we've seen historically has been substantial action in the United States to improve air quality, and that those actions did not generally reduce greenhouse gases. So those actions were mainly smokestack controls on power plants and large industries, and tailpipe controls on motor vehicles. Those were beneficial for reducing air pollutant emissions, but they did not have the effect that you would hope for to reduce greenhouse gases as well. So going forward, we have an opportunity, a choice you could say. So we could continue to burn fossil fuels and remove the air pollutants from the sources, not taking action on greenhouse gases, Or if we take action to reduce greenhouse gases, moving away from fossil fuels, we will substantially improve air quality at the same time. So we highlighted 3 kinds of actions that would reduce, that would allow greenhouse gas reductions to address climate change that would also bring substantial benefits for air quality. They are reduced fossil fuel use, improved energy efficiency, and reductions in short-lived climate pollutant emissions, especially among the suite of short-lived climate pollutants would be methane, carbon monoxide, volatile organic compounds, and black carbon. In this figure, we pulled together information from a variety of sources to present somewhat qualitatively what the effects of different actions we might take would be on air quality and on climate at the same time. So we have one axis being climate benefit to climate detriment, one axis being air quality health benefit to air quality health detriment. In the upper right, you get actions that are beneficial for both. So there would be moving to renewable and nuclear energy, moving away from fossil fuels. That would be a benefit for climate change and a benefit for air quality. Where we've been historically, the past few decades, are the blue actions focused on air quality. Motor vehicle tailpipe controls, power plant smokestack controls, and more recently switching from coal to fossil gas. Those actions have clear air quality benefits, but the benefits that they have for climate are not so clear. In contrast, then, if we're going to be taking action on climate change going forward, we need to move to the right in this figure. And we try to lay out many of the different options available that would benefit climate, with many of those actions also bringing about a substantial air quality and health benefit. As part of our Key Message 5, we reviewed 26 studies in the United States, all very recent from the literature, that analyzed CO2 or greenhouse gas reductions and what would be the air quality and health benefits that come about from those actions. Those studies all showed a benefit, but the magnitude of that benefit varies a lot, from $8 a ton of CO2 to $430 a ton of CO2. So for every ton of CO2 that would be reduced, we get a benefit for health that would be valued at something between $8 and $430. Those benefits, by and large, outweigh the costs of actions. So for the studies that also reported the costs of greenhouse gas control actions, we've plotted here the ratio of benefits to costs. So to the right of 1, which is where most studies lie, the benefits to air quality and health alone, apart from other benefits of slowing down climate change, exceed the cost of the mitigation action. And 2 studies on the left then, at a ratio of less than 1, report benefits that partially offset the cost, but do not totally offset the cost. So again, emphasizing that there are substantial benefits to be gotten for air quality and health from CO2 reductions, and that we can think about these in a coordinated way to address both problems simultaneously. That brings us to the end of our presentation. So thanks for your attention, and we look forward to your comments and questions.